women are reporting more side effects from the COVID-19 vaccine than men. The CDC is tracking this through its after-vaccination health checker. It's called V-Safe. On your side's Brownery Turner is finding out from local health experts what they are looking for and why there actually might be a difference between men and women in reaction.
Local doctors are seeing a big gender divide in side effects after getting the COVID vaccine, and there are some possible reasons for that.
This is not something unique to the coronavirus vaccines. It's definitely something that we've seen before with flu vaccines.
The CDC reporting in February that early response to the vaccine showed women reporting more severe side effects than men.
Women responded 69% of the time and reported 79% of the reactions. Men responded were 31% of the respondents and reported only 21% of the reactions.
But Dr. Elizabeth Ransom from Baptist Health says there could be many factors for this big divide in reactions.
It could be that women report side effects more frequently than men. That could account for part of it.
Dr. Chirag Patel from UF Health Jacksonville says women also have a stronger immune response because of specific hormones.
Estrogen will prompt your body to produce more antibodies to either an infection or a vaccine. So that's one big reason.
Dr. Ransom adds that women are prone to getting autoimmune diseases, which could cause a slight increase in reactivity of the immune system, but there's still no specific scientific answer.
This is not something, as I said, unique to the coronavirus vaccines, but definitely we need to do more investigation and research into why this seems to be the case.
That's why after getting vaccinated, it's important to track your side effects on V-Safe. You can go to vsafe.cdc.gov. In Jacksonville, Brownery Turner, First Coast News on your side.